This episode of D-News is brought to you by the U.S. Air Force. The best way to get over your fear of spiders is to pick up a spider. Yeah, this is gonna go fine. Hey everybody, I'm Trace. Thanks for watching D-News. Self-preservation instinct exists in every single life form. Even single-celled organisms have it. As our brains advance, we begin to grasp logic and reason and understand complex emotions like sympathy. But the limbic system, which controls fear, is still deep in there. Fear is a powerful thing, and overcoming it can be even more difficult. The amygdala is ready to hit the panic button in a second, and it's always there, deep in your brain, just watching. Evolution has built us to avoid fear, and this impulse is so strong that people who are paralyzed by trauma may change their entire social structure just to avoid triggering their amygdala. One way to get over fear is called exposure therapy, where psychotherapists use relaxation techniques combined with desensitization to help people curb and control their fears. It's a tricky business. Specialists have to balance the exposure with the relaxation techniques using classical conditioning to retrain the patient's limbic system. Sort of like Pavlov training dogs to salivate when they hear a bell, but instead you're training you not to freak out. Exposure therapy retrains the amygdala so fear responses become desensitized. They don't want to overwhelm the amygdala or the patient. They could risk re-traumatizing the person, so exposure therapy can actually take a long time. Instead, specialists work to explore the fear and desensitize just a little teeny bit at a time. So if someone suffers from panic attacks, for example, psychologists might ask a patient to get their heart rate up by running on a treadmill so that they don't fear the pounding in their chest. That's pretty intense, because over time, you would then expose them to other things. Of course, fear of spiders, heights, and sitting down, which is cathesophobia, are all pretty easy to practice with exposure therapy. When paired with relaxation training, your amygdala will tone down the panic, and patients will actually be able to overcome a fear. For things where the patient can't go back to that situation, like an abuse or military PTSD, psychotherapists are turning to technology. Virtual reality exposure can put people in controlled situations that help desensitize bits of a bad experience in a very safe environment. Rather than putting someone who is afraid of flying on an airplane, they could put them in a VR headset instead. The University of Southern California has been using VR exposure therapy since 2005 to work with veterans of Iraq and Afghanistan. Using a VR headset and an Xbox game, military personnel can experience virtual reality, 3D audio, vibrations, and even smells, which helps to selectively expose parts of their trauma and desensitize PTSD suffering. Technology to the rescue! According to an NIH study in the Journal of Clinical Psychology, even after 6 sessions, patients reported decreased feelings of psychological distress and PTSD symptoms. In another study in the Journal of Trauma and Stress, VR therapy significantly reduced symptoms in 62% of patients. So this is pretty promising. The limbic system evolved in a time when we could be killed at any moment, and the fear response was a way to keep us safe and alive. Today, it would make sense to be able to shut off this fear-based ancient brain, but we aren't there yet. Instead, we have to learn to overcome our fears and live courageously. Luckily, science is working on it. You know who's good at overcoming fear? The brave men and women of the United States Air Force. Whether it's overcoming poverty to become a nurse and an officer or becoming the first female Thunderbird pilot, these airmen are doing what others once thought was impossible. So a big shout out to the U.S. Air Force for making this episode possible. So what are you afraid of? Go ahead and go down into the comments, subscribe, and let us know. Make sure you come find us on Twitter as well, @DNews, and thanks a lot.